Today, we're here to reflect on SERHA's challenges and achievements in 2020 to 2021. There are so much we have achieved, and we want to share those achievements with you, as well as to take you on a trip to the vision of where we would like our region to go. Come with me on that journey.
The Bustamante Hospital for Children is one of the 9 hospitals in the Southeast Regional Health Authority. We are a team. We work together to make it happen. As part of SERHA, we look forward to the changes that are coming. Our recent achievements include infrastructure development. We have the establishment and the construction of the NHF Bustamante Hospital for Children pharmacy. This pharmacy is a drugstore pharmacy, and it provides a service for both inpatients, outpatients, and for the wider community based on the need. It gave us the capacity to increase the spaces that we required for delivery of service and to improve the customer service for our patients. We're indeed proud of this brand new building, which was opened and had now been able to serve in a better and wider environment for our staff and our patients. We not only have completed the construction of the NHF pharmacy, but in collaboration with the European Union, the Jamaican government, we were one of the partners, and we're successful in completion of the PROMAC Neonatal High Dependency Unit. The PROMAC program for the reduction of maternal and child mortality. And it is by this means that we now have a 10-bed high dependency unit, 2 isolation areas and 2 isolation rooms and 8 vehicles. It is with this opening of this unit that we look forward to improving the lives of our neonates, the small babies who require critical and intensive care. We're indeed proud of this achievement and the collaborative effort that made this possible. One of our major challenges is that we have outgrown our capacity. When we moved here in 1963, the capacity of the hospital was 200 beds, moving from the capacity of 40 beds at the Kingston Public Hospital. With the addition of the cardiac unit, the 10-bed ICU, which was opened in 2018, and the PROMAC HD unit, which was opened in 2020, we have now expanded the capacity to 279 beds. But even with that, we need more space. We need more ward capacity, especially for the specialist services. It is indeed our vision to improve the capacity of our wards so we can accommodate patients who need to be admitted for specialist care. With that said, the Ministry of Health, in collaboration with National House, with NHF and National Housing Trust, are in progress of building a 2-story building which will house on the ground floor a parents' overnight suite with a capacity of 20 spaces, as well as a 20-bed cardiac ward on the 2nd floor. This is just the beginning of our dream to increase the capacity of the inpatient capacity for the Bustamante Hospital for Children, with capability to now go multi-story dimension in terms of construction. It is our hope that with collaboration from private sector, public sector, that we will be able to go up to the 5 floors and improve the capacity of our inpatient wards. We are also envisioning that with the 10-year strategic plan of the Ministry of Health, that the Bustamante Hospital for Children will benefit with improvements to the accident and emergency department, to the ambulatory outpatient department, to providing improved diagnostic services with the establishment of a CT scan at present here at the Bustamante Hospital for Children. We already have ultrasound and fluoroscopy available, but again, as technology advances, we have to keep up with technology, and we need to upgrade our equipment and ensure that we are keeping up with the technology that can provide the best quality care for our patients. With the improvement in ICT, we look forward to the use of technology to make our work and our services for our patients and their families better. As such, we seek to develop the accident and emergency department of the Bustamante Hospital for Children. In fact, all accidents and emergency departments across the Southeast Regional Health Authority. It is important that we support this development. It is our aim to be able to triage early, identify cases early, as well as to expedite and introduce our management quickly, as well as to manage these patients that they can be easily sent to the areas that are required. This is where the world has already gone, and there's where we want to go, to improve the ambulatory services in terms of our capacity as well as our service delivery. In this way, our aim is to reduce the number of admissions by addressing matters early in the outpatient setting. Our outpatients department also needs expansion, and with improvement and introduction of ICT services, we envision that we will be a first-class, world-class, world-leading pediatric hospital providing care for our outpatients and our inpatients. So over the many years, we have had successful collaboration with our local and overseas sponsors. This collaboration has yielded fruit. One of the major collaborations has been in development of the cardiac services here at Bustamante Hospital for Children. As the only pediatric cardiac unit in the island, it is important that we recognize the establishment of the 10-bed cardiac ICU, cardiac catheterization unit, and the cardiac operating theater. Without this, we would not be able to continue to progress the services and development of cardiac services here in Jamaica.
The Victoria Jubilee Hospital is a premier women's hospital with focused on obstetrics and gynecology for the island of Jamaica. We see more than 70,000 women annually and deliver more than 7,000 babies per year. Our prime focus is the care of women, and women's care is our business. Over the past 5 years, there have been significant improvements in Victoria Jubilee Hospital policies and management in terms of our treatment, delivery, and service to our women of Jamaica. There has been significant improvement in delivery of healthcare as it relates to the areas of oncology, which is cancer care, where we have trained oncologists and we have a clinic where women are referred from around the island. There have been significant improvements in our sexual and reproductive health department with the placement of a consultant who specializes also in ultrasonography, which improves the overall adolescent care and family planning for our women. There has also been improvement in our infrastructure with the PROMA project, which is a European Union and Government of Jamaica project for the reduction of maternal and neonatal mortality and morbidity for our patient population. There has been the development of a high dependency unit, a 7-bed unit, which is a step-down area to an ICU, which cares for critically ill pregnant women. There have also been improvements in the neonatal care unit, where there is a neonatal high dependency unit which has the capacity to ventilate up to 8 critically ill neonates. There have been significant improvements in our postnatal services, where there has been the appointment of a consultant who cares for women in this period. The postnatal period is the period after delivery, where up to 60% of maternal mortalities and morbidities come from. We have improved in our ability to offer ventilatory support, which we started in 2016 to our neonates, where we had our first ventilator. And at the end of 2020, we were up to 4. And there have been additional improvements through the Ministry of Health. We have had improvements in our antenatal clinics through the Compassionate Care Program, where Victoria Jubilee was used as the pilot institution. There have been significant improvement in our antenatal clinics where the overall aesthetics and comfort of our patients have been improved. Victoria Jubilee Hospital has benefited also from donations from many donors, from private sector entities and from the diaspora, which has led to the improvement in our overall ventilator support, ultrasound, incubators, and other small equipment and sundries. So we continue this appeal and we continue to be in receipt of such gifts. We have had improvement in the entrances of the hospital, where the overall aesthetics and beautification through gardening and renovation of our lobby for improved aesthetics. The Victoria Jubilee Hospital boasts to have a maternal fetal medicine unit, which is a specialized unit to take care of high risk patients. We receive referrals from hospitals across the island. Our patients benefit from the Enhancing Healthcare Services Delivery Program, which is a program to deliver radiological services to our patients free of cost. The challenges are many, but we continue to work diligently with the people of Jamaica to provide the best healthcare across the island. Through the National Health Fund, the Victoria Jubilee Hospital has received 3 state-of-the-art elevators to help in the transportation of our patients while receiving.
So the hospital provides general and specialist medical and surgical services, including nephrology, oncology, endocrinology, rheumatology, gastroenterology. Some of the specialist services include ophthalmology, facial-maxillary surgery, ENT, plastic surgery, urology, and orthopedic surgical services. Despite COVID, the hospital has maintained upwards of 90,000 surgical procedures per year. The hospital, unfortunately, is known for trauma because we are an inner city hospital, and the levels of violence in society means that unfortunately we have become very good at that. But that's not the only thing that we do. In fact, some of the services that we offer are only offered at the Kingston Public Hospital. We are also a center for training. So we train undergraduate and postgraduate medical, nursing, pharmacy, physiotherapy students, as well as postgraduate doctors in all of the specialties that we offer. The Kingston Public Hospital is one of 2 facilities that provide top-of-the-line radiation oncology services via the Lynard facility, which is housed at the St. Joseph's Hospital campus. For last year, despite COVID, we were able to treat over 600 patients. The hospital is also a center of excellence for some of the surgical services. And in 2021, the first robotic surgery, which was performed in the public healthcare system in Jamaica, was performed by Criteria KPH. The hospital is also a center of excellence for spine care and has established itself as a leader in the provision of this surgical service in Jamaica and in the English-speaking Caribbean. For the anesthesia and intensive care department, the hospital has a 7-bed intensive care unit and a 3-bed ICU annex. And again, services are extended through the entire island of Jamaica, with patients being referred daily from every single facility in Jamaica. Diabetes is the #1 cause of preventable blindness in Jamaicans, and the Kingston Public Hospital is the sole facility in the public healthcare system that surgically treats these patients. Patients are referred through the screening sites throughout the Southeast region, and the hospital also accepts patients who are referred from other facilities, including private facilities. The main challenge that the hospital has been experiencing is that it has outgrown its physical space. We have not had any major construction since the 1980s, when 30,000 patients were being seen in our emergency room. And so it remains a major challenge to just manage the sheer volume of patients who pass through the doors every single day. The internal medicine department at Kingston Public Hospital was at the forefront of the management and the response of Jamaica to COVID-19. At the height of COVID, almost 100 patients were admitted to the Kingston Public Hospital. The resources of the hospital were stretched, but despite that, the hospital can boast that the death rate and the length of stay is among the lowest throughout all of the public health system. The hospital boasts the largest dialysis center in the public healthcare delivery system. Over 150 patients are dialyzed weekly through 3 patient shifts. The hospital has benefited from partnerships with both private and public organizations, including the National Health Fund. So the National Health Fund has partnered with the Kingston Public Hospital to provide 3 brand new elevators. And this has significantly improved the capacity of the hospital to transport patients and to improve the efficiency of the functioning of the hospital. The Chase Fund partnered with the hospital to expand the infrastructure, to provide equipment so that patients who are attending the Kingston Public Hospital can get first-class cardiology treatment.
1, 2, 3, 2 more. 1, 2. Adults to 30 minutes activity daily. Love your body, treat your body right. Vegetables, make sure you eat plenty. Children do 60 minutes activity daily.
Today, I will just highlight you on some of the activities for the programs that were done for 2021. And so our team consists of 12 persons, 10 health education officers, 1 public relations manager, and 1 physical activity specialist. We embarked upon activities to fulfill the Ministry of Health and SERHA mandate in order to reduce the incidence of NCDs, non-communicable diseases, among target population in different settings. Workplaces and schools were targeted in 2021. The components for wellness that the team focused on included physical activity and healthy eating. This was done in consideration for the Jamaica Moves in School program that was established prior to the coronavirus pandemic. Some activities were done virtually as well as face-to-face, as people were encouraged to observe the disaster risk management protocols. Workplaces, some of the activities that were carried out for workplaces: healthy eating challenges, physical activity challenges, both virtual and in small groups, physical activity workout sessions, stretch breaks, no elevator days, walking upstairs or breaks. This was done at the SERHA head office. In the school setting, the ambassador for Jamaica Moves in School Club encouraged and motivated physical activity breaks, and this was a 5-minute physical activity break that was a part of the Jamaica Moves in School program for the online platform while they were in school. Approximately 12 schools were doing virtual activities. For the pandemic, the team conducted counseling sessions for all vaccine sites, conducted sensitization sessions for schools and workplaces, conducted sessions to clear up myths and allay fears, and these were all relating to the coronavirus pandemic. Provided information on COVID-19 vaccines that were available. Plan, organize, and implement interventions for target populations, protocols, and these interventions were done with the transportation system, church community, and also in other institutions, as well as the community at large.
Jamaica has commenced its vaccination program exactly 1 year after the first case of COVID-19 was identified in Jamaica. This commenced the 10th of March 2021. Since then, we have identified and commenced and have opened a number of vaccination sites across the region. We have done a number of outreaches, community outreaches, school vaccination program, fixed site vaccination program, health center. We are now having sites at our hospital. So Kingston Public Hospital, Victoria Jubilee, National Chest Hospital are now having vaccination on site. Our health department is charged with the responsibility of effecting and delivering an effective vaccination program. The staff have been working to the bones and are fatigued. This has impacted negatively on the other services that is offered within the primary care setting, as the staff has to be diverted to 1 vaccination site, 2 contact tracing and management of cases, 4 to do COVID tests at our various sub-sites that we have available to us. To date, we have managed to vaccinate a total of 584,113 vaccines. So we have administered all of this, at least first and second doses. We find that we have a total of AstraZeneca vaccine, 383,435. For Pfizer, we have given a total of 160,812 vaccines. For the single-dose Johnson & Johnson, we have given 39,833 doses. And Sinopharm vaccine, only 33 doses. For the population of SERHA, 21% of our population is fully vaccinated, and 45% of our population have had at least 1 dose of the vaccine. We look at our healthcare workers, which is a part of our community that is very important to us, as our job is healthcare delivery. We find that we have a coverage of healthcare workers, 61.8% of our healthcare workers that are fully vaccinated. And we have a little over 80% that have had at least 1 dose of the COVID-19 vaccine. Across the region, we have been able to achieve a number of difficult vaccination sessions. We have utilized the mobile vehicles, which was afforded to us by the Ministry of Health and Guardian Life mobile unit. So we were able to reach some of the communities to offer community outreach. We also did a number of school vaccination sessions to ensure that our school children are ready for school. We offer house-to-house service for shut-ins, and for St. Thomas, they would have gone through and do what we call a walk and talk, whereby the mobile unit would travel to a particular community or road, and our community health aides and our nurses would walk. For whenever they identify persons who are unable to come out, they would go inside their homes and give the vaccination. And for persons who could come out, would come out to the mobile vehicle to be vaccinated. We have also done a number of nursing homes in Kingston and St. Andrew and in St. Catherine. For St. Thomas, I've only had about 2 nursing homes, so there I didn't have to do a lot of that. Mainly they had the house-to-house for the shut-in. In terms of the uptake of the vaccine, there's a lot of vaccine hesitancy in St. Thomas, and so therefore that is the area where the uptake was the least. Kingston and St. Andrew have done the majority of the vaccination that's done in SERHA.